This episode of the Modern Therapist Survival Guide is brought to you by Productive Therapist.
You should be able to change the world and love your life. Productive Therapist can help you save time, make more money, and feel a sense of relief. They provide mental health virtual assistance, business coaching, and unique training and support programs.
Look out for a special offer just for you at the end of this episode.
This podcast is also brought to you by Mulberry.
Mulberry is a creative studio known for building fabulous custom websites, reasonable rates, and an obsessive dedication to customer service. Mulberry is a perfect fit for modern therapists ready to improve their online business presence.
Stay tuned after the show for a special offer from Mulberry.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhalm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhalm with Katie Vernoy, and this is the podcast about all things therapists and the things that we do, the things that we don't do, the things that we try to do. And today we are... Katie's looking at me like this is the meander.
What are you talking about?
Sometimes I have really good intros to episodes, and sometimes this is where we sit. So
there we go.
And maybe in the spirit of this episode, how ready are we for this to be our greatest episode ever after the very phenomenal intro that we had? We're here talking about motivational interviewing with one of our Therapy Reimagine 2021 speakers, Hillary Bolter. Thank you so much for joining us today.
Absolutely. And you're modeling what it is that you're supporting listeners in, which is being your real self and being okay with that.
We'll take it. We'll take that. Yes, that is exactly what we're doing. So the first thing that we always ask our guests, who are you and what are you putting out into the world?
My name is Hillary Bolter. I'm a licensed clinical social worker, and I'm a trainer in motivational interviewing. So essentially, I believe that I help cultivate effective helping professionals through motivational interviewing.
So we were talking right before we started recording, and Hillary asked us, what our experience with motivational interviewing is. And I'll be honest that I've done a number of courses on motivational interviewing and seen a lot of very thick books on motivational interviewing in both teaching, back when I was writing licensing test questions. And a lot of my reaction to this has just been, this just makes sense. Why is this so complex when this could really be done in just a couple of pages? But
so you're saying people are writing too much?
I am saying that this is something where I think very naturally fall into a lot of the principles and aspects of this. And I don't understand why it's so complicated to so many other people all of the time. But apparently people make some mistakes in this. I probably do too. But what kinds of mistakes do you see people making with motivational interviewing, or potentially what am I bypassing by not reading those very thick books that are things that can help our listeners maybe not make those same mistakes?
Right. And your experience is really similar for many people. They will say, hey, this motivational interviewing stuff, it makes sense. It feels intuitive. There is like this level of recognizing the essence of MI and how, we want to be doing that, or I am doing that, right? So there is that resonance that people feel. Motivational interviewing is simple, but not easy. So in that simple way, the essence is pretty simple, and I can describe it more and kind of define it for you. However, practitioners, we find it really hard to actually implement the full kind of gamut of what motivational interviewing has to offer us, such as withholding that writing reflex. That is really hard for people to do across the board. Are you all familiar with that term, writing reflex?
No, I have no idea what you're talking about. I had
You're
like
a
lunch and learn on motivational interviewing. I was like, this is amazing. I want to do this. And subsequently did not do anything about that. So Tell me everything. I want to know everything.
Tell you
about
everything. I will give you the download. Yeah, absolutely. And Katie, your experience is very common as well, that people along the way have been exposed to MI like a lunch and learn or a day training, or it was mentioned in a class in graduate school. MI has been around for nearly 40 years. And so it's a buzzword. We've all heard it. We know it's evidence-based, and most people think they're doing it or using it to some extent. And I think in order to know if we're using it or not, we need to really know what it means and what it means to be doing MI, air quotes, doing MI,
Yes.
using MI. And I'll go back and explain the writing reflex, because I think that is one of the things that's hard for people to kind of pull back or rein in. And the writing reflex, as defined in MI, is that tendency for helping professionals to persuade or convince others who are ambivalent about change. So say we have a client who's like, I know I should, but they're in that place of ambivalence about change. We have a tendency to want to kind of get on the side of change argument. Like, yeah, that's a great change to make. I could totally see how that would be helpful for you. Or have you thought about doing this to help you with that change? That's the writing reflex at work, where we have that instinctual response as helping professionals to help people change by helping convince them of the need to change. So that's what that is. And when we are using motivational interviewing, we're staying out of that writing reflex, because we are falling back on this belief and the skill set that comes with it of cultivating and evoking from the client. So rather than imparting that information about change or persuasion to change, we're evoking their motivation for change.
And here I thought you were going to say that the mistake that most people make with motivational interviewing is just labeling anybody who's resistant as being in the pre-contemplative stage.
Yes. Oh, the pre-contemplative comment trap. Yes. And, many people associate the stages of change with motivational interviewing. They are different. The fun fact, they were presented at the same addiction conference back in the early 1980s. So people often associate them together, and they go really well together, because motivational interviewing is designed to help someone resolve their ambivalence about change. So we're working with people in that contemplative stage of change. I should, but, there's that ambivalence, the strength on both sides of change. MI is really useful for folks in pre-contemplative as well, because it gives us some tools to engage with them and join with them and explore what they are willing to change in that moment. So confusing the two is one of the common kind of mistakes, like of, oh yeah, they're the same, or you have to know one to use the other. They're helpful to look at. I think of the stages of change as such a helpful assessment tool for us in looking at client readiness. And it can also help us inform when I'm using MI and when not to, because MI is used to help people, move along the stages, resolve that ambivalence, pre-contemplative, contemplative stages of change.
So now I'm realizing that I actually have learned less about MI, because I think in the 2-hour training, I think there was at least 45 minutes on the stages of change. So what does using MI really mean?
Yes. What does it really mean? So I sometimes in my mind, I picture, I'm very visual in my mind, like a picture the Maslow's hierarchy of needs triangle. We've got the base of the triangle. So I'm gonna create a hierarchy of motivational interviewing triangle for us to conceptualize MI. At the base of the MI triangle is the spirit of MI. And the spirit of MI, woo, what is that?
I know. That sounds really fancy.
You got the spirit. It's the attitude that we bring to our clients. So there are 4 elements of spirit in motivational interviewing. And this attitude that we bring to our work. And that is empathy. That is collaboration. That's like, hey, there's 2 experts in the room. I have expertise as your provider. You have expertise in your life and wisdom. You know best what's going to work or not work for you, right? So it's this attitude that together we can put our expertise together and help support you in change, right? It's not that I'm the expert and you're the patient, right? Together. So collaborative attitude. Evocation, which is I'm going to learn about my client from my client and pull out their motivations, their ideas. And those are, in fact, more important than my ideas for them. And we have acceptance. and compassion, right? This compassion for our client. The Carl Rogers unconditional positive regard. People are doing the best they can, unconditional, positive beliefs. So that's the base of the triangle, this spirit, this attitude that we bring. And I think that's what many listeners, and probably you all as well, connect to. You're like, yeah, I have that spirit. I hold that belief when I'm working with my clients in session, right? So that's the base of the triangle. How does that land for you all?
Exactly. I'm like, okay, I do that, except what you already told me about the writing impulse. And I think I do that too. So more to learn still.
Yes, right. So that spirit resonates and makes sense, the attitude that we bring to the clients. The next sort of notch into that triangle of motivational interviewing is the OARS skills. So OARS. Are you all familiar with those? You're like, yeah, I've heard of that.
Nope, not even a little bit.
I love it. Honesty. So the OARS stand for open-ended questions, affirmations, reflections, and summaries. And the OARS skills are essentially the micro skills of motivational interviewing. They are the how we get there. We guide conversation by asking more open-ended questions than closed, by providing affirmations that highlight strengths and abilities and efforts that we see our clients making. We do a lot of reflections, reflective listening, and we provide summaries that help consolidate and guide the conversation. So many people will say, oh yeah, I do that stuff too. I ask questions and I affirm and I reflect and I summarize.
Yes, exactly.
Yep.
Still with you. So
Still
except for knowing about this writing reflex, I am totally doing motivational interviewing.
Yes. So the tip of the triangle is this change talk component.
Okay. This is probably where I'm going to go wrong here. So what does this include?
Yes. So one of the things we know from change research is that the more people talk about change, the more likely they are to change. And so our task when we're using motivational interviewing is to guide the conversation in a way that is going to help our clients talk more about change, why they want to make that change, how they might want to make that change, what values do they have that are really guiding that change, what strengths do they have that they're going to utilize when they're making that change. And so this change talk component of MI is this awareness of the need to pay attention to our clients' change language, which is their why change, their motivation for change, versus their sustained talk language, which is like the why not. That's the other side of ambivalence. So we pay attention to that change talk language, and we are doing some specific methods to cultivate and strengthen change talk over the course of an interview.
This seems to be the part that I think a lot of people can kind of over rely on certain kinds of questions here. Mm-hmm. I hear, some clients, totally not mine, that are like, you're asking too many scaling questions. You're just making me ask, number questions. And you talked about kind of the soft skills of that middle part of the pyramid here. This is where some of those really good clinical skills come out, is in kind of this tip of the triangle and eliciting change talk.
It is. And you named scaling questions. That's one of the tools of MI. I had a participant in a training recently who was a physician's assistant, and she said, I've taken trainings in MI before, but it felt too tools focused. It felt like, here, use these scaling questions. And it felt like kind of forced to her, like she was supposed to use these particular techniques. And she took a much longer training with me, a little longer than the Lunch and Learn. And really, that's when it all kind of came together, these pieces of how do I practice this attitude and spirit? How do I use the OARS skills to selectively guide the conversation towards a specific change? And we integrate those tools like scaling questions, as well as many other tools, in a way that really helps our clients talk themselves into the change, instead of relying upon that kind of traditional advice giving, information giving, or writing reflex, persuading, kind of getting on the bandwagon of, here's why you should change, which when somebody's truly ambivalent and we start to argue for change, their tendency is to argue against change. Yeah. And I'm imagining we can all sort of think about those clients that we work with or who have worked with who are like, I don't know, I should. and we start saying, sort of arguing and supporting the change side, they tend to say, but. And that's the
you're then
opposite.
eliciting the reasons why they're still ambivalent.
Exactly, which strengthens that not change side. And so in motivational interviewing, one of my cues to myself of like, oh, I need to remember to get back into my MI skills is when I'm arguing for change and my client is arguing against it. That's the exact opposite of where we're going with MI, which is where we're cultivating this conversation to support the client's motivation and argument for change.
I think the time when I am most likely to argue for change is when I see a really unhealthy behavior, whether it's dangerous relationships, dangerous coping strategies, those types of things. How do you get to a place where you can kind of safely be in that space of helping them make the decision and kind of talk themselves into change while also not appearing to collude with really dangerous or unhealthy behaviors? Because as a professional, if I say, sure, let's figure out, how do you decide whether you're going to cut or not? Let's keep you cutting, like, whatever it is, right? Like it's something where how do you hold both of those things when trying to stay away from arguing for the healthy behavior? Because that's where I struggle the most. Like most of the time I'm like, oh, well, how do you make a decision and what would make the difference there? And, those kinds of things. Whereas when someone's doing something that's really dangerous, it is so hard for me to, not something that's immediately life-threatening or thing I would need to report, like certainly not that, but like something that feels very dangerous if it doesn't change within the next period of time. How do you, what are your recommendations there?
Right. When you feel some urgency beyond that, for that change, and you want that to happen soon, this question is a good one, and it makes me pause to take a step back to consider the style of communication that we're in at any given moment with a client and how we learn to make some intentional choices around that. And so Stephen Rolnick, the co-creator of MI, has identified 3 styles of communication. There's the following style, there's the guiding style, and there's the directing style. And there are times as a clinician where we are choosing consciously to follow the clients, like in whatever they're wanting to talk about, or we're following them if they're ambivalent about something like whether to have a second child or not, whether to, things that's clearly we're not going to weigh in on that. We're going to follow.
Yes.
Then there are times when we are directive and we make a conscious clinical choice to be more directive in that. Like we have consent to give, say this, we need consent for this, or this is information that I need to provide to you. That's more directive. And then there's times where we make a decision to be sort of in between the two of those, which is guiding, and motivational interviewing is a guiding style of communication. And so in the cases of some more sort of scary or alarming behaviors, we may need to make a conscious clinical choice to move into a more directive style of communication. We may be able to stay in that guiding style of communication, join with our client, clarify what that goal is, evoke from them what motivation they might have. Why might they want to decrease or stop the cutting? How is what they're doing problematic for them? Reflect that to them so they're hearing themselves speak, and hearing their wisdom, their inner wisdom that we're drawing out. And then we may, tool in motivational interviewing is called elicit, provide, elicit. It's a little acronym where we elicit first, then we provide, and then we elicit again. So I may say in the case of talking with a client who is cutting, I may first ask some of those open-ended questions like, what's problematic about this for you? Tell me more about ideas you have that might help you to stop this or what you could do instead. And then I might move into the provide part of that acronym and provide some information or provide my concern. I'm concerned about this. There's this resource that I would really love to give you to follow up with about that, for instance. But I don't want to forget the other end of that acronym, which is elicit again, which is like, what do you think of that? How does that land for you? What might you want to do about that? So that when we're providing information, we're not assuming that it fits the client or that, like, oh, I just gave you the best piece of information and assuming they're going to take it and run with it. But we're going to check back in and say, yeah, what do you think? What do you make of that?
we send questions over to our guests. Here's some things to prepare to talk about. And one of the questions that we had sent over to Hillary was, how has MI stayed relevant for so long? And I'm changing this question of, why isn't motivational interviewing more widely used? It seems to be kind of, I don't know, in the second tier of theories that gets taught to a lot of clinicians. That's kind of like, oh, here's this thing that works. Why isn't this being more widely used in a lot of therapist education?
And that is a wonderful question. I think that's a question that the creators of MI continue to sort of ask and challenge graduate programs. Why is this not a standard? Why is this not taught as a semester course? Some do have it. I've taught it as a semester course for a college because it is so much about, the research shows that the attitude that we as therapists bring to our clients impact outcomes. Our ability to demonstrate empathy and to collaborate and to be genuine and to evoke and draw forth them really impacts outcomes. So why are we not teaching these skills that are embedded in learning motivational interviewing? I don't know what the answer to that is, because they are available for us to learn. I'm like, here's the motivational interviewing platter. It's like an awesome buffet to munch from.
And it seems like it fits even within other theoretical orientations too. Like, these seem to be some of those, universal skills. The unconditional positive regard, is not just limited to humanistic type therapies. These seem to be skills that are used a lot. And my first experience with a lot of motivational interviewing was working with substance abuse, where I know that this is widely used in my practicum. And I know that there's a couple of things where MI is not necessarily the best thing, schizophrenia, bipolar disorder, some of those things where people don't recognize that they have problems. But this does seem to be such a core set of skills that I think just get bypassed in getting taught.
Right. And so that's a piece of what kind of we know. We go through school and we learn some skills, and then we hit the rubber meets the road and we're out there working with people, and we're like, how do I become more effective working with the clients that I'm working with? And that was my personal MI story. Was, I finished grad school. I feel like literally I've got all these tools in this like backpack on my back. I've got all these tools. I'm like ready to help people, woohoo. And then I'm face to face with clients who say they want help. I have services that are going to help them, but they're not following through with those plans. And I felt such tremendous frustration and even sometimes resentment, right? Like, what's the problem here? But I didn't have the tools. Graduate school didn't teach me everything that I needed to know about how to be with clients, how to talk with clients. And at its essence, motivational interviewing is a conversation style. It's not a modality. It's not a skill set. There are skills within it, but it's a way of talking with people. It is a way of being with people. And I took my first MI training, and which typically kind of a typical intro is usually like 10 to 12 hours of training. And that first MI training, I felt this physical shift of this burden of responsibility of me knowing the answers and me having the tools, on my shoulders, to this recognition that my task is to walk with clients and believe that they have the tools or can acquire the tools when they're ready, and to draw those forth. And so it was this lightening of responsibility. That's like, oh, I don't have to know it all. I don't have to be so prepared with all of the ideas and motivations for and skills for people. I need to first join with and be and believe and draw forth, using these OR skills and some other specific things that kind of help people connect more deeply to their motivation for change.
I'm hearing a few things in this, because I think being able to really walk with, I really like that image. When we're looking at walking with, I think there's an inherent trust that the client will get to what's best for them, that they will come to with appropriate guidance, support, whatever it is, to the change that should could, needs to, whatever the right phrase is, to be made, right?
Mhm.
And there are a lot of things like our own bias, our own idea around what is health, what is right for people, all of those things that we bring to the table. And a million years ago, when I had that very short lunch and learn, it seemed like MI was a way to get people to believe that the change we want them to make is in their best interest. And it was like, okay, this is how you frame it, like tie the change you want them to make with another change that they want to make and figure out their motivation that will get them to do the change you want to make. Clearly, it was not a great training because they didn't tell me that the stages of change were not MI. So, but it was interesting because it felt in some ways manipulative, but the way you're describing it feels not that. It feels like I am here, I'm trusting my client, I'm walking with them, and I'm using my clinical skills to help them to move towards where they want to go.
Mm-hmm.
But for me, there is that piece of the guiding type of conversation where you are leading them toward a change that you believe is in their best interest. So how do you hold that tension of not guiding them towards a change that may not be in their best interest? I mean, especially if they have different perspectives or different lived experience than you, like you may not know what their best interest is. So how do you hold that tension of health, and this is what society says is in your best interest, and the client? Like, how do you hold that?
That is such a wonderful question because you named the tension that is one of the misconceptions of MI, which is that it's manipulative and it gets people to do what you want them to do. And that is not motivational interviewing. That's sales potentially, right? Right. And when we look back at the spirit of motivational interviewing, this domain of compassion, which is that we are always working in the best interest of the client, is the foundational component. So it's not about what I want them to do. It's about what is in their best interest. And most of the time, we can agree with a client on what that is, through some exploration. Like, okay, somebody who's cutting wants to stop cutting. Somebody who's misusing alcohol wants to get that under control or stop, right? So I'll name two pieces. One is this foundational piece of compassion helps keep the client's best interest at the forefront. The second is motivational interviewing has 4 processes. So kind of like the stages of change, the 4 processes are linear, but also recursive. Sometimes we have to revisit sort of the previous process. And those 4 processes are engagement. So we first must engage and develop rapport with clients, connect. The second process is focusing. What is that target for change that person wants to make? The third process is evoking. Why do they want to make this change? What are their values? What are their strengths? What is, building their why? And then that fourth process is planning. That's the how. How do we get there? How do we help you get to this change? We are doing MI when we are staying in that spirit that we've talked about, using the OR skills through engagement, through focusing, and through evoking, those first 3 processes. That's doing MI. Now, your question speaks to the second process, the focusing process. And that is another kind of misconception of MI is, we can use MI all the time with anything or to get them to do what we want them to do. But the focusing process really clearly defines what is it that the client is willing to talk about or willing to consider change around. We're bringing our expertise in it, we're evoking their expertise, and we're helping to discern the direction of the conversation.
It lands really well. I still think that there is the possibility, and Curt will say that, well, there's always a possibility for bad therapy. But I think there's still the possibility if someone has unchecked bias or unchecked stuff that they bring in, that focusing process could be fairly manipulative. But I think true MI, good MI is let's focus and really see where the client is and meet them where they are and bring our expertise into that to help them provide that information that may or may not land with them, but then pull back out and really rely on the client. I really like that. I think it's just something where oftentimes I get caught in wanting to tell my clients what to do. And, so
much so, right? And when we do let that writing reflex take over, or we give advice, or we're just moving out of MI into our other styles of communication, which can come from a place of compassion and knowledge and all of those other good things. So it's not that it's bad to not be doing MI. We're just shifting. This is a part of, as we're developing as clinicians, that we have lots of tools in our tool belt. And back to Curt's question earlier, like, why is MI kind of not everywhere? Why isn't everybody not learning it? That's a great question, because it's a great tool really for anyone to have, not just therapists, but anyone who's helping people with change, anybody who's working with clients who are struggling with the ambivalence that are wanting to change. And motivational interviewing, it started in addiction, but it is in so many fields now. I recently went to a trainer where I listened to, participated in breakouts on MI in work with offenders, MI in education, MI in child welfare, am I in suicide prevention? Am I in health coaching? I mean, it's
everywhere, just not as much with therapists.
What's happening there?
Well, and even beyond the helping field, some of the better uses, and I love how you frame this as a communication technique. Some of the best application of this is salespeople that are, kind of that communication style of, they know that the hard sell on things isn't going to work, but it's being able to bring it in. And so there are even people outside of our field who utilize it a lot better than us.
Well said. Yeah, I remember, this example sticks out from a training early on. I had some people who were former military and in a training, and several of them had worked in interrogations. And as I was going through these skills, and helping to teach each of the ORS skills, they were like, yeah, this is the stuff we learned in interrogations. And I was like, oh, wow. Right. And some people in sales will also speak to some of these techniques as like helpful to get people to kind of motivate to do something. And that's, again, where I fall back to that such essential piece of the spirit of MI, which is the compassion, the best interest of the client, not the best interest of my wallet or the best interest of my organization numbers or the best interest of my spiritual beliefs, but the best interest of the client.
That makes sense. So clearly there is more to learn. What should clinicians interested in learning MI look for in training, or what are the trainings that you might recommend that people take?
Definitely. Yeah. Well, the metaphor learning to ride the bike is sometimes used in talking about MI. So we don't teach people how to ride a bike by talking about it and describing it and showing slides about how to ride a bike. We do it through experiential practice. You really can't really get that concept of balance until you're trying to balance. And so what I would look for in a training is an experiential component where you're getting to practice the skills with others, getting feedback from a trainer in that process. And the motivationalinterviewing.org website lists all the trainings provided by MINT trainers, members of the Motivational Interviewing Network of Trainers.
If people are interested in reaching out to you, where can people find you?
My website is bolterconsulting.com. And I'm on Instagram, Hillary Bolter. And I also have a private Facebook group where I am really active in helping people in their MI learning journey. And I also created a code for your listeners for a Foundations of MI course, a 10% off. So I will give that to you all.
So we'll put that in the show notes. For folks that don't always get to our show notes, how might they access that special offer?
So Modern Therapist Survival Guide, MTSG, that is the coupon code that we're using.
MTSG is a coupon code. And what's the website where they can access that training?
It's bolterconsulting.com, BOLTER.
All right. We'll put that in the show notes.
And you can find our show notes over at mtsgpodcast.com and check out the Therapy Reimagined conference and all of our latest updates on that. Things are changing as the world opens back up, and we're part of that process. And so I'm not going to commit to what our changes are at this moment because the website's easier to update than traveling back in time and changing published podcasts. So check out therapyreimaginedconference.com And until next time, I'm Curt Widhalm with Katie Vernoy and Hillary Bolter.
Thanks again to our sponsor, Productive Therapist.
Do you want to get more organized, be more productive, and learn to delegate like a pro? If so, the Productive Therapist Insider Program can help. It's a monthly membership that includes full access to their online course library, an exclusive print newsletter, personalized support, and discounts on coaching services. The program will help you get more done so you can have more fun.
As a listener of this podcast, you can get the first month for just $1 by using the coupon code MODERN, all caps. Visit productivetherapist.com/insider to learn more.
This episode is also brought to you by Mulberry.
Mulberry is a creative studio known for building fabulous custom websites and an obsessive dedication to customer service. The friendly team at Mulberry can take your private practice website to the next level with a complete redesign or help with your current website. Mulberry is a perfect fit for modern therapists ready to improve their online business presence. As a special welcome to listeners of this podcast, Mulberry is offering 10% discount up to $250 on any service they provide.
Mention the Modern Therapist Survival Guide podcast to receive your welcome discount. Visit Mulberry at mulberrywebdesign.com today.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.